Hi, my name is Cassie Meyer. Today I will be administering medication. So the first thing I'm going to be doing when I administer medication is properly count my medicine. So I need to go into the quiet room and make sure I'm not chattering with any colleagues and my phone's turned off and I'm not distracted by anything else when I count out the exact medicine that I need to be giving to my patient. And the first way that I would do that is check my 5 rights comparing my MAR to my patient care order form. So the first thing I'm going to check for is the right patient. So I have Jaguar Jones on my MAR and Jaguar Jones on my order form. That was the right patient. The right medication is heparin and heparin. The right route is subcutaneously and subcutaneously. The right unit or the right dose is 5,000 units and 5,000 units. And the right time is every 12 hours and every 12 hours. And I see that no one has documented that Mr. Jones has gotten this medicine in the last 12 hours. So now I'm gonna go ahead and get my medicine gathered. So the first thing I'm going to do is perform hand hygiene. And I'm going to gather my supplies for the right patient, which is heparin. So I'm gonna get my medicine and it's heparin. I'm going to make sure that it's not expired, and it's not. And I see that I need 5,000 units, and this is 10,000 units per milliliter. So that means that I would only need a half of a milliliter. And the right route is subcutaneously, so I'm going to be getting my 1 milliliter TB syringe needle, or TB syringe, with a 25 gauge and a 5/8 inch. The reason I chose this is because the 25 gauge is typical when you are performing a subcutaneous injection, and the 5/8 inch is because when I assessed my patient earlier, they only had a 1 inch, they only had a 1 inch amount of skin or fat to grab instead of 2 inches. Next, I see that it's every 12 hours and every 12 hours, and no one has done it in the past 12 hours, so it is the right time. Okay, so now I'm going to prepare my medicine by calculating the dose, which is 5,000 units of heparin, and I have heparin and 10,000 units per milliliter, so that means I only need half of a milliliter to equal 5,000 units. So 5,000 units. So the first thing I'm going to do is clean off the top of my medicine and throw this away. And I'm gonna, or the top of my vial for 3 to 5 seconds. And throw away my alcohol swab. And next I'm going to get my TB syringe. And I'm going to double check the dosage calculation, 10,000 units per milliliter, and I need 5,000 units per milliliter, or 5,000 units, sorry. So I only need a half of a milliliter. So first thing I'm going to do is uncap my needle safely and pull back to a half of a milliliter, where the black line is just, or the black stopper is right at the 5.5 milliliter line. The next thing I'm going to do is insert my needle into the heparin vial, because I've already checked it. Turn it upside down, push in the oxygen that was in my needle, or the air, not oxygen. And I'm going to pull back to at least 0.5 milliliters. And then if I see any air bubbles, I'm gonna pull back further. So I'm gonna pull back a little bit further than 0.5 milliliters. Make sure there's no air bubbles, and there's not. So I'm going to push back into the 0.5 exactly milliliters and remove my needle. So next what I'm going to do is not recap, but use the scoop method to put the cap back on. So now I'm going to check all of this again before I go to my patient. And I'm going to see that the medicine is heparin and heparin. The 5,000 units, and I have 10,000 units per milliliter, so I need 5,000 units, and that is a half milliliter. And I have a half milliliter. Next, I'm going to check the right route, and that's subcutaneous, and the right time is every 12 hours. And now I have a label for my patient, or for my syringe, and I have Jaguar J. Jones as the right patient. Right medication is heparin, and 5,000 units as the right dose, and 5,000 units as the right dose. And I'm going to attach that to my syringe. The next thing I will do is verify my medication and dosage with a nurse if I need to. So now I'm going to go to my patient's room. The easiest way for me to do this is actually to just move my supplies over instead of panning the camera. Okay. So I'm walking into my patient's room. I say, hey, Mr. Jones, let me perform hand hygiene. Okay. And now I'm going to double check my patient with 2 identifiers. So first thing I'm going to check is my MAR for his name, Jaguar J. Jones, and his wristband, which is Jaguar J. Jones. Now I'm going to check his date of birth, 8/25/1963, 8/25/1963. His MR number is 4176352, and his MR number is 4176352. So I've identified my patient by 2 things, and now I'm going to check his allergies. And I see on my MAR that he is allergic to penicillin, and on his wristband, penicillin is also listed as an allergy. So Mr. Jones, I'm going to be giving you medicine, and I see that you have an allergic reaction to penicillin. What kind of allergic reaction? Well, today I will not be administering any penicillin, so you will be all right. So now I'll check that. And the last thing I'm going to do is check my 5 rights one last time. So I see that this is the correct patient, Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones, the right medication, right patient, the right medication, and that's heparin. And I see that I need the right dosage, it's 5,000 units and 5,000 units. And the right route is subcutaneously, and every 12 hours, and no one has done it in the last 12 hours. So I've checked my 5 rights for a 3rd time. So Mr. Jones, I'm going to explain to you that today I'm going to be giving you a abdominal injection of heparin. And now I'm going to raise your bed to working height and put down the guardrails. Now I'm going to put on my clean gloves. Don my goggles. And now I'm going to assess the patient's skin, the area of which I'm going to be performing my injection or administering the medication. And what I'm going to do is pull back his gown to only show the area which I'm giving the injection. And today I'm going to be giving it in the abdomen area. So I'm going to look for 1.5 to 2 inches around the umbilical cord, and I'm going to only look at the area under the intercostal space. I'm going to be looking at the area above the iliac crest and between the anterior and posterior iliac spine. And so that leaves me with a U region around the umbilical cord. And next, I'm going to assess your skin for any cuts or bruises or lesions or anything that could be a problem. And I'm also going to make sure that your vitals are all right and you're not having any increasing heart rate or anything else that's wrong, or your blood pressure is all right. Okay, so I see that your skin is intact, and I'm going to palpate the area and there's no redness or bruising or lesions or scratches. So I'm going to clean off the area. Dispose of that. Dispose of that. And I'm going to start in the middle and move to the outside region in a circle. And now I'm going to leave my alcohol swab pointing at the area which I just cleaned. Okay, so now I'm going to get my medication and I'm going to uncap it and I'm going to pull back the area of the skin which I am performing the medication or administering the medication. Since I'm left-handed, I'll be doing this in my left hand. I'm going to go in at a 45-degree angle. And I'm going to push in, well, first I'm going to aspirate to make sure I don't draw back any blood. And I don't, so I'm going to slowly push in the medication. And pull back. And I'm going to apply pressure and make sure there is no allergic reaction. And I'm going to dispose of this in, well, first I'm going to dispose of this in the sharps container because I want to get that out of my hand as quickly as possible. Dispose of my alcoholic swab and dispose of the cap in there. Okay, before I take off my gloves, I'm going to assess for any allergic reactions that are happening around the site. And there don't seem to be any. He seems to be managing the pain well. I'm going to check Mr. Jones and ask him if he's doing all right. And now I'm going to, before I take off my gloves, throw away my needle, check his site of injection for any allergies, that's what I already did. Check that Mr. Jones is all right. And I'm going to reposition Mr. Jones comfortably into the area that he likes to sit. I'm going to lower the bed rail and put up the guard. Sorry, Mr. Jones, and put up the guardrail. And now I'm going to take off my gloves, dispose of them. And now, Mr. Jones, I'm going to correctly document, or not Mr. Jones, he doesn't care. I'm going to document how the patient managed, what exactly I gave him in my initials, and I'm going to document. Oh, and perform hand hygiene one last time because I took off my gloves. And then I would document, and then I would come back to the patient and assess him at the appropriate time in accordance to what medication I gave him to see how he is doing.